Good afternoon, everybody. Myself, Dr. Manish Rijhwani. I am Associate Professor at the Department of Dermatology, Mahatma Gandhi Medical College and Hospital, Jaipur. So today I'll be taking lecture on acne, which is a common presentation in adolescents. And the slide deck is courtesy Indian Association of Dermatologists, Venereologists and Leprologists. So it's a digital lecture series from IADVL. So coming to the introduction of acne, it's one of the commonest skin conditions seen usually in adolescents. It's easily diagnosed as it is one of the common manifestation at this age, and most of the population knows about acne. And as it is over the face and involves the adolescents, it may affect the mental and social well-being. So the patient is drawn towards the dermatologist for the lesions over the face and the complications of acne like pigmentation and scarring. Multiple therapeutic options are available and it requires skill to treat. Successful management requires tailor-made treatment. So the treatment depends according to the presentation and according to the severity of the cases. It usually affects around 80% people at some point in their life. So definition of acne vulgaris. Vulgaris is what we call as commonest form of acne. So anything common, vulgaris is added to the term. So acne vulgaris means the commonest form of presentation of acne. It's a chronic inflammatory disease of the pilosebaceous unit, which is characterized by seborrhea. So this is one of the common features in acne. Each and every term is very important. Formation of comedones, erythematous papules, pustules, and less frequently by nodules and cysts and scarring. So these are the complications of acne if not treated properly. So coming to epidemiology, it typically occurs around adolescence, but can present in neonate as well, because the presentation of acne in neonates is because of the passage of hormones from the mother to the child, and it can also persist beyond adolescent and susceptible individuals because of the preponderance of the hormonal imbalance. The physiological acne considered as a normal variant. Clinical acne persists and progresses beyond the period of adolescence. So in such cases, proper investigation is needed and hormonal therapy is advised. 30% of teenagers have acne of sufficient severity to require some form of treatment. So acne is of multiple grades. We'll go through these in the coming slides. Now coming to pathogenesis of acne, which is the most important part of the presentation, and this also dictates the treatment part in acne. So first one is the increased sebum production, that is what we call as seborrhea. Seborrhea is the increased production of sebum. Second is hyperkeratosis of the pilosebaceous duct. So this hyperkeratosis of the pilosebaceous duct leads to formation of microcomedones, which plugs the pilosebaceous duct and which leads to accumulation of the sebum. This accumulated sebum gives a perfect environment for colonization of the propionibacterium acne, and colonization of propionibacterium acne leads to inflammation, and sometimes because of the increased sebum accumulated, the pilosebaceous unit bursts and it leads to much more inflammation and finally preponderance of the nodulocystic acne. So this diagram shows the pathogenesis in a diagrammatic representation. Initially, the first one is a normal pilosebaceous unit. Second is the plugging at the exit of the pilosebaceous duct, which leads to accumulation of sebum in the below the plug, and finally the colonization of propionibacterium acne and inflammation. Now coming to the grades of acne, so usually we divide into 4 grades. The first grade is the beginning, when there is seborrhea and the plugging of the pilosebaceous duct, what we call is comedones. There are 2 types of comedones. One is open comedone, which is equivalent to the black comedones, and white comedones are the closed one. Occasionally papules may be there. Now coming to the grade 2, papules are predominant and few pustules are also there, and of course comedones are already there. In grade 3, predominantly pustules are there, and it may lead to nodules and abscess formation. And finally in grade 4, nodulocystic lesions are there, and finally scarring is there. So grade 1 mainly comedones, in grade 2 mainly papules, grade 3 is mainly pustules, and abscess. So these are the problem in the projection in this case. So half of the picture is coming. This is grade 1. The picture is showing grade 1 type of acne, where you can see, you can appreciate both the types of comedones, the closed comedone and the open one, and few papules are there. I think we missed the grade 2 acne. In grade 3 acne, you can find erythematous papules, few nodules, and deep pustules are there. So preponderance of pustules is there in grade 3, and finally in grade 4 you'll find much more of nodulocystic lesions over the cheeks. And the consequence of all these grades of acne finally leads to scarring. So scarring is an important consequence of acne if not treated. There are two complications that sets in if the acne is not treated on time. One is hyperpigmentation and other is scarring, and this is the reason acne should be treated as soon as possible. So this is the consequence of abnormal resolution or wound healing following inflammation. And there are two types of scars mainly. Ice pick scars usually is found in some patients with grade 1 and 2 acne, and depressed or hypertrophic scars are seen in the severe forms of acne like nodulocystic acne. Other complication is hyperpigmentation. So in patients particularly with type 3 and 4 skin or higher skin types, hyperpigmentation may persist following the resolution of the inflammatory acne. So this is very important to treat the patients as early as possible to prevent complications like hyperpigmentation and scarring. So this is the picture showing hyperpigmentation after resolution of the acne lesions. Now we discuss acne vulgaris, that is the commonest form of acne. Now coming to the uncommon form of acne, will not go deep into each and every type of acne, but we'll just enumerate the uncommon types. The uncommon types are acne excoriae. I'll show a few pictures also that will be more explanatory. Acne conglobata, acne fulminans is a severe variety of acne. Acne mechanica, pyoderma facial, tropical acne. Drug-induced acne is also important, which we find in day-to-day practice. These are also called acneiform eruptions, and mainly from the use of steroids in regular practice. Occupational acne, late onset acne, it's also called endocrinal acne. These are the late onset acne post adolescence. Cosmetic or pomade acne, and last but not the least is gram negative folliculitis, which is also important, and the treatment is a bit different for gram negative folliculitis. Some of the pictures are missing in this deck. This is a picture of chloracne, then acneiform eruption that we discussed, usually post-steroidal acne eruption. Note the hypertrichosis. So hypertrichosis is also one of the complications of steroids. So in this case, topical application of steroids led to multiple acneiform eruptions and hypertrichosis. Now coming to the differential diagnosis, usually in adolescence over the face, we think that acne is usually these are all acne, but it's not always acne. It's a list of differential diagnosis from which acne should be differentiated. The common ones are rosacea. So this is also present over the face. Mainly it presents in form of papules and pustules on an erythematous base. Petrosporum folliculitis, pseudofolliculitis, melia, plain warts, tuberous sclerosis. I'll show few pictures of this, and it will be much more clear from the pictures. Then acne scarring may be mistaken for acne keloidalis, varioliform atrophy, and porphyria cutaneous tarda. We'll not go deep into these topics. So this is a picture of rosacea. So it's a erythematous background and multiple papules are there, especially over the central part of the face and neck, and especially in these cases you will find swelling over the nose. This is Petrosporum folliculitis, usually in the seborrheic area, multiple papular erythematous lesions, and it can be differentiated from acne. As such, in this there is symptom of itching as well. So coming to the therapy in cases of acne, so the mainstay is the general measures are very important. The acne should be treated as soon as possible so that it doesn't go into severity into grade 2, grade 3, grade 4. Then it becomes a bit difficult to treat, and then it becomes difficult to avoid the complications as such. So most important before coming to the oral therapy and topical therapy, the lifestyle changes are very important. Diet should not be of higher glycemic index. Less of carbohydrates and fried food is advised, and less application of cosmetics are advisable. So oral therapy, usually what we are giving nowadays is erythromycin pulse dosing is given. It's usually we give 500 milligram thrice a week for at least 6 to 8 weeks. Then in tetracyclines, mainly we are using doxycycline and minocycline as well. And in severe cases where there is no response to normal treatment, we go for dapsone treatment. So few slides are missing in this presentation. Sorry for that. So before that, there was the slide missing was of topical application. So usually topically we are applying clindamycin. So this is the mainstay of treatment nowadays. So clindamycin is applied twice a day. Then retinoids, especially adapalene, is applied at night. And other topical agents, important one of them is benzoyl peroxide. Now coming to isotretinoin, so this is the drug which acts on all 4 pathogenic factors, and it has a real amazing effect even in a complicated acne or severe acne. So mechanism of action, as I already said, it covers all the 4 pathogenic mechanisms of acne, usually indicated in nodulocystic acne or severe acne, and where there is excessive seborrhea, or even in cases where there are lesions are fewer but patient is depressed or having dysmorphophobia and is having multiple scarring or pigmentation, and it's a drug of choice in acne conglobata. Dose is usually 0.5 to 1 milligram per day, and it is usually given after meals. Side effect, the most dreaded one and important one is teratogenicity. So this drug should be avoided in females who are planning to become pregnant, or the female should be properly counseled so she will not go for pregnancy and will take contraception properly. Other common side effect is dryness. So it usually leads to cheilitis, it leads to dryness over the lips and even dryness of the eyes, where we use tear drops are used and emollients are used over the lips. It may lead to elevation of serum lipids. So serum lipid profile should be done before starting isotretinoin. Usually serum cholesterol and serum triglycerides are done before starting the therapy, and these are measured regularly. Now physical modalities that can be used are comedone expression. So comedo expression is to remove the comedones, both the black and the white one, closed comedone or the open comedones. Superficial electrocautery is done in cases of macrocomedones. Aspiration of cystic lesions. Intralesional steroids are used in cases of nodulocystic acne. In nodulocystic acne, usually we aspirate the material and then we inject intralesional steroids so that the inflammation is reduced and the chances of scarring are much less. Other therapies that can be used are cryotherapy, and usually sometimes we are using alpha hydroxy acids. So these are chemical peels in cases of acne or acne scarring and pigmentation. Newer options that are coming are on the way, or few of them we are already using, is photodynamic therapy by using the blue or the red light. So this acts on the Propionibacterium acne and reduces the number and helps in resolution of the inflammation. Low fluence pulse dye laser again is used for acne and for decreasing the erythema post acne. Dermabrasion, carbon dioxide lasers, these are used for scarring. So mainly carbon dioxide laser is used in ice pick scars. Erbium YAG laser is used in atrophic or hypertrophic scars. And finally, we may go for acne surgeries in form of punch grafting and punch floats for depressed scars. So the severity of acne is different in each and every patient, and so the acne treatment is also devised according to the severity of acne. So coming to the acne treatment plan, so proper plan should be done in each and every case of acne. Topical therapy is usually given only for the grade 1 and grade 2 acne. Oral antibiotics in moderate to severe acne. Combination with topical retinoids improves efficacy, and when benzoyl peroxide decreases resistance. So benzoyl peroxide is one of the agent which we have still not found any resistance. So antibiotics should be used less often and benzoyl peroxide should be used more often, so that we don't get resistance to antibiotics, topical antibiotics. Duration usually suggested to the patient should be 4 to 6 months. It's not that the lesions will resolve in 15 days or 1 month. Usually patient should be counseled properly so that he takes regular treatment for 4 to 6 months. So any treatment started must be continued for at least 6 weeks. So in dermatology, usually drugs take around 6 weeks to fully manifest and gives their effect. So at least 6 weeks should go before we see that the lesions are not responding, or before we plan for changing the drugs. And patient should be counseled about the various side effects of each and every drug. Systemic isotretinoin is indicated in severe nodulocystic acne, acne conglobata, and acne recalcitrant to routine therapy. So this is, as such, is the last drug which can be used, but it can be used in cases where patients have dysmorphophobia or scarring. Hormonal therapy is indicated in patients with moderate acne who also need contraception, or those who need hormonal therapy to regulate hormonal irregularities. So those patients having hormonal therapy, hormonal imbalance, should be treated with hormonal therapy, and certain patients who have acne beyond adolescence should be investigated and treated with hormonal therapy, and compliance should be encouraged. So last but not the least is the photo quiz. So whatever we have gone through in today's presentation, we'll present few of the photographs to evaluate whether proper understanding of the topic has been there. So coming to the quiz, we have put 3 photographs. So first photograph, lesions are there over the face. You have to describe the pathogenesis of these lesions. So according to the new medical education policy, each and every topic has been assigned the significant part of the topic. So in this topic of acne, there are 3 points. One is the pathogenesis, second is the grading of the acne, third is the treatment of the acne. So these photographs are pertaining to these 3 educational points that we should cover in this lecture. First picture, you have to describe the pathogenesis of these lesions. Second picture, you have to identify the grade of acne shown. So as we have already gone through the various grading, you have to just grade the acne in this case. And finally, third picture, you have to assess the picture and outline the management in this case. So thank you so much for patient listening. Thank you.